Hi, I'm Jean-Pierre Farage. I'm a general surgeon and have been in practice of medicine for over 20 years. I have currently got a concept for healthcare and I'd like to share it with you. At this current time, there's been a lot of talk made about the 50 million Americans that don't have health care, and they're uninsured, and there's references that suggest that they're going untreated. That is in fact not true. Since time immemorial, physicians have always taken care of patients with or without insurance, and in fact, yes, there were 50 million people last year uninsured, and all of them were treated in emergency rooms, ERs, and clinics, mostly on an emergency basis. Now, my current concept is, rather than get some sort of universal Medicaid, don't pay me. You're already not paying me. I'm not asking you to pay me. Don't pay me. Let us, the physicians, keep taking care of these patients for free. Don't charge the patient. Now, the argument will be made that the patients will end up waiting till the last minute, showing up in the ER, and that's inefficient. I agree with that argument completely. So in an effort to bring patients in sooner, I have a simple solution and a simple suggestion. My plan is to let people that don't have insurance, and we're talking about this 50 million once again, which are they work, they make too much money to be eligible for Medicaid, they are not old enough to be on Medicare, they don't have enough money to get private insurance. We know what subset of the population this is, and so this is all this plan addresses, this 35 to 50 million people. My plan is simple. Show up, get treated. The physicians that take care of you don't bill you. Instead, they take your reasonable and customary charge, cut it in half, and then are allowed to take that 50 cents on the dollar as a tax credit on their either corporate or personal income tax, with the proviso that the best they can do is break even on taxes. They don't ever make net revenue from the government. Now, that sounds like, well, that's a tax break for the physicians. Well, no, what it is a stipend to physicians for a service that they're currently providing for free, that in Congress they're attempting to create a bill to pay for this service that would cost over $1 trillion. In my current plan, if you were to take, let's say, maybe 300,000 practicing physicians in the country, and you take the average income of the physicians, and then you surrender the tax from that at the 33 1/3% bracket, what you end up with is about $15 billion. Now that sounded really big until you heard $1 trillion or 1.5 trillion. So for about 1% of the current plan, we can take care of all the patients in the country. And we can do it in a week. It's very simple. They show up, they get treated, we file it on our income tax. If any physician falsifies claims, it's criminal penalties. Quality improvement is already there because everyone is board reviewed or hospital committee reviewed, and so we have plenty of peer review, and we don't distinguish as physicians between the patient that had appendicitis that was insured or uninsured. Now, the fact of the matter is, by treating patients sooner, what's going to happen is we get them when they're less sick. So, to coin the president's favorite phrase, we're able to give them a pill instead of an amputation. And so the guy comes and sees me with cellulitis of his foot instead of gangrene of his leg. Now, I am able to treat him with a much more conservative approach. These patients would be welcomed in the offices of physicians around the country, particularly if they were allowed to incorporate the stipend. Now, once this happens, we will actually improve the quality of care of patients and have better quality outcomes, which means we'll start to see them sooner, which means the cost will actually be reduced. Once the cost is reduced, the physicians will be deducting less. So not only does this program have quality improvement, it has cost reduction built in. Now, it's a simple solution. It doesn't create jobs. There's no place for pork. This is just the providers take care of the patients without any middlemen. and the best they can do is break even on their taxes for revenue that they would have generated somewhere else in the practice. Now, it doesn't address all the other issues like should we be able to sell insurance across state lines or tort reform. I'm in favor of all those things. But if what we're talking about here is the emergency gap stop for these 50 million Americans, and there's some level of urgency, then I say let's do it now, because you can do this in 2 weeks instead of collecting revenue for 4 years and then allowing people to get insurance, which is the current plan. And it won't cost $1 trillion. It'll cost 1% roughly of what they're estimating. If you divide 15 billion into 50, or let's say even 45 million, you come out with about $300 per patient per year, which is less than any government plan. So the bottom line is, don't pay me. Just let us take care of them for free like we always have. And now instead we'll get a small stipend, which will encourage people to come in sooner into offices instead of ERs, and we can solve the healthcare problem. The rest of it can be dealt with on a piecemeal basis, and I think that would be fine. Thank you for your time. If you would like, this idea has been published on General Surgery News, the August edition 2009. General Surgery News, August edition 2009. And it's called Uninsured But Not Untreated by J.P. Farage, M.D., F-O-R-A-G-E. Thank you.